I remember telling my mom, now brace yourself when you see this.
I really fought back tears when I saw her. I was shocked.
It was a shade of purple I've never seen on the human flesh before.
I can't even describe how horrible it was to watch her.
I was actually afraid that my daughter was going to lose a child.
Next, two medical mysteries that defied the experts. When 27-year-old Amanda Nixon wakes up to find her breast mysteriously changing colors, little does she know she's about to begin a desperate fight for her life.
I almost felt like I was in a movie and it wasn't me. I didn't understand what was going on.
Then, since the day she was born, 6-month-old Andrea Vandenburgh has been erupting in violent crying fits. But when no doctor can explain it, her parents decide to take matters into their own hands.
At that point, it was like, what's happening to my daughter? She could die. I had no clue. I said, somebody needs to listen to me.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. Amanda Nixon was born in the spring of 1978 and spent a healthy, active childhood living in Northern California.
I was a real playful little girl. We lived in a really small town. I had a couple good girlfriends that I would play with.
But as soon as she entered adolescence, Amanda's body began to develop what she considered embarrassing curves.
I think my breast got to about a size 36F. I was very ashamed, and I did whatever I could to conceal them.
She also found it very difficult to run like other girls. She wanted to participate in sports, but she always felt like she was top-heavy.
I just had this huge weight everywhere I went, and I had excruciating back pain.
Over the next 10 years, Amanda does her best to manage her discomfort and adapt to her adult figure. Then, shortly after graduating from college, she strikes up a friendship with a coworker who understands all too well what Amanda's been going through.
Amanda and I actually have similar body types. I casually brought up that I had a breast reduction when I was 20 years old, and she asked me what it was like, and I told her it made me more confident.
Inspired by Betty's experience, Amanda decides that it's finally time to get a breast reduction herself.
I was really excited about this upcoming surgery. I just kept thinking of what it would be like to have these wonderful small breasts.
In February 2005, Amanda undergoes the procedure, which brings her breasts down 2 full sizes. The operation leaves her bruised, swollen, and in pain, but emotionally, she's never felt better.
I was on top of the world. I felt amazing. I mean, immediately I could stand up straighter. I could walk around with just a t-shirt on, not these layers that I'd been used to wearing.
Over the next 2 weeks, Amanda's swelling diminishes and the pain gradually subsides. And when she goes in for a follow-up visit with her surgeon, everything seems fine.
She said that this breast reduction was a success and that my breasts looked normal and that the bruising would go away, so I was very happy.
The doctor assures Amanda that most patients are fully healed by the 8-week mark. And sure enough, as spring rolls around, she seems to have made a complete recovery. Then, one morning when she least expects it, Amanda's overcome by a strange sensation.
I had both hands on the steering wheel, and all of a sudden, my right arm just slipped off the steering wheel. And I just felt this excruciating pain, and I couldn't for the life of me lift my arm back up.
Thankfully, within a few moments, the agonizing pain lets up and Amanda regains control of her arm.
I just continued to drive. You know, there was some traffic, so I didn't want to pull over, and I just went, wow, that's so bizarre.
Frightened by the strange episode, Amanda immediately makes an appointment with her cosmetic surgeon.
I knew that I shouldn't be feeling that way. I just had this gut feeling that there was something wrong.
But after performing a thorough exam, the doctor can find nothing wrong with her. She assures Amanda that sometimes pain spasms are just part of the healing process.
I thought it made sense that these side effects were normal from a breast reduction surgery.
Amanda continues to experience the agonizing spasms off and on over the next few months, but does her best to grin and bear it. Then in August of 2005, a disturbing new symptom begins to emerge.
My right breast just didn't feel the same as my left breast. There was some sort of mass about the size of a golf ball.
And she asked me if that happened to me when I had my breast reduction, which it had not. And I told her she should probably follow up with her plastic surgeon.
Unnerved, Amanda checks back in with her doctor, hoping that she can explain the alarming new development.
She told me it probably was just scar tissue, not to worry about anything, and she told me to stop being so paranoid.
She was telling me, Mom, it just doesn't seem right. They can't seem to find anything wrong. I reassured her that the doctors knew what was going on.
But despite the doctor's assurances, Amanda's symptoms begin to take on a life of their own.
My breast was becoming engorged and hard. When I was in the shower, I noticed that the entire breast was this reddish, pinkish color. And I was thinking, this can't be normal. I mean, my other breast looks fine. And then it started causing me a lot of pain. I let it go for a little while. I was hoping that it would go away. The fact that I had these other complications going on with this surgery, I was very embarrassed. I'd been turned away from my doctors, and I did think maybe I was being paranoid.
But by the time Christmas of 2005 rolls around, Amanda can't ignore the situation any longer.
My breast was like almost an eggplant color, and it had the appearance of an orange. It was dimply all over.
On a trip home for the holidays, she finally decides to show her mother what's going on.
I remember telling my mom, now brace yourself when you see this, and just the look on her face said it all to me.
I really fought back tears when I saw her. I was shocked.
Ever since 27-year-old Amanda Nixon had breast reduction surgery, she's been plagued with what her doctor believes are normal side effects, including seemingly random pains in her arm and a hardened mass in her breast. But over the last 6 weeks, Amanda has developed a bizarre new symptom.
I was having a severe pain in my right breast, and it was purple and engorged. I didn't understand what was going on.
Worried that she's developed an infection, Amanda makes an appointment with her surgeon, but nothing could have prepared her for what she says next.
She took one look at my chest and she said, "You need to go have a mammogram."
But when the nurse tries to get an image of Amanda's breast, she immediately runs into a problem.
My breast was so engorged and so hard that she couldn't close the machine properly. There was a lot of pain.
After 20 excruciating minutes, the nurse finally calls the whole thing off.
She basically said, "You know, honey, I'm going to pray for you." And I thought, wow, that's a really bizarre thing for a nurse to say. And then another doctor came in and said, "We're going to take you over here for a biopsy." At that point, I was like, there really is something wrong with me.
Once the biopsy procedure is complete, Amanda goes home and anxiously waits for the results.
I was scared to get a call back. I was doing everything I could not to think about it.
5 days later, her doctor's breast care coordinator calls Amanda with news that turns her world upside down.
She said, "Amanda, are you sitting down?" I said, "Yes, of course I'm sitting down. I'm at work." She goes, "Well, you have breast cancer." I immediately hung up the phone and left the office. I went to my car and I called my mom.
Her voice was shaky and I knew something was wrong. And she said, "Mommy, they told me I have breast cancer." And I felt absolutely nauseated.
The next morning, Amanda and her mother head straight to the clinic to begin what they know will be an uphill battle.
I had all kinds of fears that were going through my mind. I actually was hoping that I could trade places with her, and that was a mother's wish.
I almost felt like I was in a movie and that it wasn't me. I guess I didn't want it to be me. I was really scared. The surgeon was going to evaluate me to see if I could have surgery right away or if I needed to have chemotherapy. He looked at my breast and saw how engorged it was, and he said that there was no way that he could operate on me at that time.
In fact, the surgeon has never seen symptoms like Amanda's before and isn't sure what's causing them. But he does know that her hardened breast tissue will make it impossible for him to identify the cancerous areas that need to be removed.
He told me that if I had chemotherapy, my breast would return to its natural color and become soft again, and I would be in less pain.
10 days after learning she has breast cancer, Amanda begins chemotherapy. Nervous, but hopeful.
I went into this room, and you're literally in a chair facing another person who's hooked up to an IV. It was overwhelming. I mean, everybody in there was twice my age.
Amanda endures the intensive chemotherapy for 3 months. But when she goes in for a follow-up visit, the doctor has some devastating news. The chemo didn't kill all of the cancer cells. They now have no option but to remove her entire right breast.
He told me that I needed to have a mastectomy, and it was very emotional at that point in time, trying to think of what it would be like only having one breast.
On April 19th, 2006, Amanda goes into surgery for a mastectomy. The doctors declare the operation a success, but it takes a huge toll on the young woman.
The first time that she actually came home from surgery, she wouldn't look at herself. She wondered if she would ever look normal again.
I had really poor self-esteem at that point in time. I just didn't feel very good about myself at all. It's really hard to be 27 and my whole life had changed in a short period of time. It was very overwhelming to have something that I didn't understand go on inside my body. It was just beyond me. I just didn't know what was next.
When Amanda Nixon's breast becomes discolored and swollen, it takes months for doctors to realize that the bizarre symptoms might in fact be signs of breast cancer. But the devastating diagnosis leaves no time to solve puzzles, only time to start treatment. And now, after completing a round of chemo, followed by a radical mastectomy of her right breast, Amanda's learning to cope with a new body.
After my mastectomy, I knew I would only have one breast. I was bound with bandages. I was afraid to take the first look to see what it would be like missing.
I think it was extremely difficult because of her age. It was very painful for me to know that that had happened to her.
Traumatic as the situation is, Amanda is sure the worst is behind her, until she gets a phone call that sends her reeling. A pathologist has found 2 cancerous lymph nodes in the tissue that was removed during surgery. This is a sure sign that the cancer has spread.
It terrified me. I was scared. I didn't want something that was aggressive. I didn't want something that was invasive.
The news is devastating. Now Amanda will have to endure 6 more months of aggressive treatment.
I knew that I had a long road ahead of me. I still had a lot of chemotherapy and radiation. My worst fear was that I wouldn't make it.
It was hard to see and just know how sick she was.
It's a big knot in your stomach to see your child go through something like that and be so helpless as a mother.
I couldn't do all the things that I'd love to do. I decided that I would just kind of focus on me and getting better.
Amanda coped through that time with the strength of a fighter.
Then, in December 2006, she completes her last round of treatment. and soon after, her oncologist delivers the news she's been waiting almost a year to hear. Amanda is cancer-free.
I was really excited. He told me he would be seeing me on a yearly basis, so that was like my farewell.
I was elated. Amanda was elated. It was such a relief at that point.
Still, Amanda can't help but be self-conscious about the mastectomy. So in May of 2007, she undergoes reconstructive surgery on her right breast.
It felt great to have two breasts again. They felt like a whole person.
While her battle is finally over, Amanda continues to wonder about the mysterious and highly unusual symptoms that accompanied her breast cancer.
Nobody had made the connection before about the dimpled skin and the red, engorged breast. When I was first diagnosed, I didn't even think to ask why my breast was so red and why it had gotten hard. I just wanted the cancer out of me at that point.
In an effort to learn more, she soon joins a support group for young cancer survivors.
I met some girls that were diagnosed with breast cancer, and they were all under 40. It was really refreshing. I didn't feel so alone anymore.
She started hearing more stories about what other people had been through, trying to find the right answer for where she fit in.
I listened to some of their problems, and I thought, wow, we all have different things going on.
Amanda is particularly surprised when she learns that none of the women in the group have ever heard of the strange symptoms she experienced during her bout with breast cancer. Not one.
At that point, I was like, this isn't normal. I started to know that there was something more going on.
It's a thought she just can't let go of. So after some deliberation and more research, Amanda decides to run her entire case file by Dr. Joan Kroner, a well-respected breast oncologist in her area.
When I met Amanda, she told me that after she'd been aware of some changes in her breast for some time, she'd been diagnosed with a very aggressive form of breast cancer, and she'd actually completed her entire course of therapy. After I reviewed her charts and all of the records, I was surprised.
She goes, well, I have some news for you.
It was clear to me that the diagnosis was something new that she hadn't heard before.
I was almost in disbelief. That information was almost hidden from us. And I really couldn't believe that healthcare professionals could do that to such a young person.
I don't think she really understood everything that happened to her.
After enduring 6 months of chemotherapy and a mastectomy, Amanda Nixon has been told that she's breast cancer free. But Dr. Joan Kroner believes that Amanda's far from in the clear. In fact, she's confident that her doctor overlooked several critical clues that could change everything.
In reviewing her chart, it said the whole breast had become hard and it had become purplish and discolored, and the skin had developed a lot of little dimples. And that's a very strong indicator of a very serious problem.
As Dr. Kroner delves deeper into the medical history, she becomes convinced that Amanda has been misdiagnosed.
The skin had what's called dermal lymphatic involvement, and those are fancy terms for the little lymph channels that are found in the skin, which is the dermis, had cancer in them. And that's basically an absolute diagnosis of inflammatory breast cancer.
Inflammatory breast cancer, or IBC, is a very rare and very lethal type of breast cancer. In patients with more common manifestations, the cancerous cells clump together into tumors. But in patients with IBC, the cells grow in sheets within the skin, blocking the lymph vessels and giving the breast a signature inflamed appearance. This pattern of growth allows the disease to spread more rapidly than other forms of breast cancer.
When I found out my diagnosis, I was upset. I'm thinking in my head, inflammatory breast cancer? What's she talking about?
No one ever put the label of inflammatory breast cancer in her chart, but the diagnosis was clear. It's important to make this diagnosis because it's probably one of the most aggressive forms of breast cancer. It tends to spread in a manner slightly different from other forms of breast cancer. in that it will sometimes spread all the way across the chest wall, onto the other breast, and up along the skin, even onto the back. The places that it can spread are the bones, the lung, the liver, and at late stages, the brain.
Unfortunately, because IBC is so aggressive, it has the lowest survival rates of any form of breast cancer. Only 40% of patients survive past 5 years, and only 30% live for more than 10 years after their diagnosis.
When I found out about the survival rates of IBC, it was very overwhelming. It changes things. It puts everything in perspective.
When Amanda told me the information about inflammatory breast cancer, I was definitely frightened for her. My worst fear is that I would lose her.
As the gravity of the situation sinks in for Amanda, Dr. Kroner goes on to explain that the spasms in her right arm were most likely the first sign of IBC.
Inflammatory breast cancer can actually cause pain, particularly in the breast. Pain in the arm is usually related to enlarged lymph nodes under the arm. In general, the indicator of inflammatory breast cancer is going to be the changes in the breast itself, usually the skin becoming discolored red and purple, and then dimpled. The mechanics of why the skin changes is lymph fluid backs up in the skin, and the channels, which are now plugged up, cause the pores pulling in. In terms of the redness, my suspicion is that it's the body trying to fight against this abnormal process and causing inflammation.
IBC can also cause the breast to become engorged and hardened as the cancer invades the breast tissue.
Most patients will have breasts that are very firm because they have a lot of inflammation in the skin.
With the new diagnosis in hand, Amanda and her family are anxious to know if she was given the right treatment to begin with.
Even though it hadn't been stated in the chart, I wanted to reassure her that she had received absolutely the right treatment. For inflammatory breast cancer, it's important that it be treated with chemotherapy prior to doing surgery because the cancer tends to spread so early. If she had had surgery first, there would be a much higher chance that the cancer would recur and spread, and the chance of cure would definitely be lower.
Although relieved by Dr. Kroner's assurances, Amanda can't help but wonder why her symptoms weren't diagnosed as IBC sooner.
It's common after surgery to have a mass develop or to have scar tissue develop. And in a 27-year-old who just had breast reduction surgery, that's exactly what you would think it is. Inflammatory breast cancer may not have a lump at any time, and it may not even be seen on any of the special imaging tests. So you have to get a biopsy done.
Adding to the difficulty of making a diagnosis, Amanda is much younger than most IBC victims.
Her situation is a really unusual one. I don't think I have ever had a patient under age 30 who had inflammatory breast cancer. It accounts for less than 1 or 2% of all breast cancer.
While IBC may be rare, when it does hit, it hits harder than any other form of breast cancer. The harsh reality is that if Amanda suffers from a recurrence, it could kill her.
The risk that I'm most worried about would be that her cancer could recur or spread into a vital organ, in which case it would become a life-threatening disease. If breast cancer comes back, rarely can we cure it. Because inflammatory breast cancer grows at a more rapid rate and spreads more aggressively, the biggest problem is trying to diagnose it and get aggressive treatment started before that happens.
While Dr. Kroner can't make any guarantees, she explains that they can face the situation head-on. Every 6 months, she'll need to give Amanda a rigorous evaluation to make sure the disease is still in check and take immediate action if necessary.
Now that I have been diagnosed with inflammatory breast cancer, I'm definitely looking for any irregular things going on with my body or my breast. If I have any kind of rash or discoloration, I'm going to go see Dr. Kroner right away.
Today, Amanda is 31 years old and one of the youngest survivors of inflammatory breast cancer in the country. She's very active in several breast cancer organizations, including one specifically focused on IBC.
I think this has given her that self-confidence to go out there because she knows that she has such an important message to deliver.
From this shy little girl that she used to be, it's just a total changed person. I can't express how proud I am of her.
When I speak to the girls at the support groups, I do advocate that they ask questions and they do things that I wasn't comfortable doing. I really want to empower these other people to be informed.
While Amanda Nixon was shocked to learn that she had contracted a life-threatening disease, Heather Huestis knew there was something wrong with her baby from the very beginning. In 2007, Heather Huestis and her fiancé, Ed Vandenburgh, were living with their 2 small children in rural New York. They were sure their family was complete, until Heather found out she was pregnant again.
That was a pretty big surprise. It was great. Ed kept saying it was going to be a girl. I was just hoping for a healthy baby, of course, like any other mother.
She's so great with her other 2 kids that I knew she was going to be great with her 3rd one. It's just a natural for her.
On September 13th, 2007, just 4 days before her due date, Heather gives birth to a healthy baby girl they name Andrea Megan Vandenburgh.
We left the hospital the very next day. She had no problems after birth at all, and we were just happy to bring our new baby home.
A few days after Andrea's birth, Ed starts a new job as a long-haul truck driver, and his schedule leaves Heather on her own most of the time as a stay-at-home mom.
He was normally gone Monday through Friday and sometimes Saturday. I was handling it just fine. I mean, to toss another baby into the picture, it really wasn't all that different.
However, during her first week at home, Andrea quickly proves to be more of a handful than Heather anticipated.
Andrea started becoming pretty fussy. She would cry a lot more often than I remember my other 2 children crying.
Sometimes when Andrea cried, it looked like she was in pain. And I just asked Heather, oh my God, is she okay? And was this normal?
Concerned about Andrea's constant crying, Heather consults with her pediatrician, but he assures her that there's nothing to worry about.
He said, is she running a fever? No. Is she going through diapers? Yeah, she's going through diapers normally. They'd say, it's probably just colic. It's just something you're going to deal with.
Heather knows colic can last for months, so she's expecting Andrea to be fussy for quite some time. But when she's 2 weeks old, the newborn does something that takes everyone by surprise.
I was holding her and just looking at her, talking to her, and she would break out into this cute little smile. And I would say, you're 2 weeks old. You should not be smiling yet.
The first time Andrea smiled, I actually commented to Heather, oh, she's got gas. They don't smile at 2 weeks old. We noticed she smiled after that all the time.
Unfortunately, when Andrea isn't smiling, she's screaming at the top of her lungs. Heather finds her baby's behavior baffling.
She would go from one extreme to the next. She would be screaming, and then she'd be happy again. It looked like mood swings, to be honest.
But if that pattern isn't puzzling enough, in Andrea's 3rd week of life, a new and alarming symptom begins to emerge.
She would eat, and about an hour later, she would throw up, when most babies keep it down, and she would scream bloody murder.
I talked to the doctor about this, and I say, this can't be right. Babies spit up, was my answer. I didn't think she was getting enough to eat, but he said, she gained 3 ounces. As long as she's gaining, that's good. I trusted the doctor.
However, over the next 3 weeks, Andrea's eating problems show no sign of slowing down.
She was vomiting after every meal. I would feed her, and 2 hours later, she would all of a sudden make this horrific noise. Her face would turn beet red. Her fists were balled right up, and she was shaking. It hurt so bad. Clearly, something was not right.
From practically the moment Heather Huestis brought her newborn Andrea home from the hospital, she's been exhibiting an odd pattern of behavior. She cries violently one moment and smiles blissfully the next.
She would stop the fit of screaming, and she would break out into a big smile. It was kind of boggling.
On top of that, Andrea's been vomiting after nearly every meal.
I didn't know what to do, but I said, well, maybe it's something I'm eating. Maybe I should stop breastfeeding her and try formula. formula didn't make a bit of a difference. It was the same issue. She still vomited.
Heather was always saying, I'm so tired and I get no sleep. It was definitely taking a toll on her.
I was stressed. I had 2 other children to take care of besides her. And of course, Ed not being around, that made it even worse.
At Andrea's 2-month checkup, Heather once again points out the feeding problem to the doctor.
I said, she's got to have reflux. And all this pediatrician would do is stare down at this little smiling ball of joy. And he said, she doesn't have reflux. But within a couple days, she was vomiting even harder.
No matter what Heather tries, Andrea simply can't keep much of her food down. And to make matters worse, her physical development seems to have come to a standstill.
We started noticing that things just didn't seem right. She wasn't turning over. She wasn't even trying to sit up.
She would not keep her upper body still. She had such stiff, jerky movements.
Concerned, Heather takes Andrea back to the pediatrician, determined to find out what's been slowing her daughter down.
I walked into the doctor's office, and I told him, she has jerky movements. She did not seem to be gaining weight. She needs to be evaluated for her developmental delays.
The doctor gives Andrea a thorough exam. He then asks Heather a question that stops her dead in her tracks.
He was asking me how much attention I was giving her, and how much did I feed her.
The doctor goes on to suggest that Andrea's developmental delays may simply be the result of poor nourishment.
It infuriated me. I'm clearly bringing her to you with issues. And instead of investigating the issues, you're going to point the problem back at me. Why aren't you listening to me?
Over the next 6 weeks, she continues to experiment with different foods, but it's clear that Andrea's not improving. By the time her daughter is 5 months old, she's still far from hitting any of the normal benchmarks.
You could see something wasn't right, proportion-wise. Her head hadn't grown. I mean, literally, it looked like a newborn still to me. I'm not a doctor, but I know if her head's not growing, her body's gonna suffer.
Andrea wasn't doing everything that normal babies did. She never babbled, never said a peep, never talked.
Tired of getting nowhere with her regular doctor, Heather is determined to find someone who will take her concerns seriously.
I called up the doctors and I said, put me in with the chief of pediatrics, I'm done. Somebody needs to listen to me.
2 days later, she brings Andrea in to meet with the hospital's top specialist.
I broke down in this doctor's office, and he could clearly see how concerned I am about my daughter. He could see she was not growing. He said her head was extremely small. She had very bad microcephaly.
Microcephaly is a condition in which the head measures significantly smaller than normal. It occurs when the brain hasn't developed fully or has stopped growing. The condition can lead to severe developmental delays, and in Andrea's case, her jerky movements and poor motor skills are probably related to the microcephaly.
He said, I want to refer you to a pediatric developmentalist. He might be able to get to the problem. That same day, I got a phone call from his secretary telling me that the developmentalist would not take her insurance. I said, well, what am I supposed to do? Who else are you going to refer me to? And she said, there is no one else. We can't help you any longer. And that was the end of the phone call. I was left alone to deal with it myself.
Heather has no idea where to turn next, and the entire family begins to fear the worst for Andrea.
Angie was not flourishing, not eating, not even trying to sit up. She wasn't doing anything.
I just remember telling my mother, I'm afraid she's gonna die. If she just keeps deteriorating, there's nowhere else for her to go.
At that point, it was like, what's happening to my daughter? She could die. I had no clue.
At the end of her rope, Heather takes matters into her own hands and drives Andrea directly to the Albany Medical Center, over 2 hours away.
The doctor came in and he looked at her and he said, what are you doing in the ER? What are you asking of me? I'm asking you for help. She's not gaining weight. Do something. I can't do this anymore.
At Heather's urging, the doctor weighs Andrea and can hardly believe his eyes. the 7-month-old tips the scales at just 10 pounds, 9 ounces, almost a full 7 pounds lighter than what she should be.
He was appalled. I mean, he was the first doctor that actually looked at this little girl and said, "Are you kidding me? This little girl has not gained any weight. There's something wrong."
20 minutes later, Heather's introduced to pediatric resident Dr. Danielle Dunitz, who immediately gives Andrea a thorough head-to-toe examination.
She was acting like a 3 to 4 month old. I was immediately suspicious that there was something else going on, given the severity of her delay. But she was smiling constantly, and it wasn't to anything in particular. So I asked Heather, "Is Andrea always this happy?" And she's like, "Yeah, and definitely more so than my other children."
Andrea's smile instantly reminds Dr. Dunitz of a rare genetic disorder she read about in medical school.
A lot of symptoms that Andrea had were pointing to this one disease. Happy demeanor, jerky movements of the arms and legs, developmental delay, issues with growth, speech delay.
She really didn't explain much, but she said one of the major signs was extreme happiness in a baby. And I said, "Happiness? That's a symptom of something?"
Heather Huestis' 7-month-old daughter weighs just 10 pounds. Her head is abnormally small, and she can't sit up on her own. But still, she seems happy all the time. Dr. Danielle Dunitz suspects she knows what's causing the bizarre constellation of symptoms and immediately refers her to geneticist Dr. Darius Adams to confirm the diagnosis.
When I first met Andrea, she was smiling and happy. She was a very small child and also did not have a normal head circumference, and she wasn't feeding very well. Also, she wasn't babbling normally. Those were all factors that made me suspicious.
Dr. Adams suspects that Andrea is indeed suffering from the extremely rare disorder Dr. Dunitz read about in medical school, but he can't be sure until he tests Andrea's DNA. As a next step, he takes 4 vials of blood from the infant and sends Heather home to wait for the results.
I was just relieved. A big town hospital says, "Something's wrong with your daughter." And I'm like, okay, now it's just waiting for the phone call. I need the phone call.
It's 4 long weeks before the news she's been waiting for finally comes in.
Dr. Adams said, "We have a hit on chromosome 15. There's a deletion." And I remember going, "What does that mean?"
We did a chromosomal microarray analysis, and we found that she was missing a segment on chromosome 15, and that gave us the definitive diagnosis for Angelman syndrome.
Angelman syndrome is a rare neurological disorder which can be caused by a random chromosomal irregularity or genetic mutation. Patients with Angelman are missing a segment of their 15th chromosome, which is associated with a gene that contributes to neurological development. This chromosomal abnormality causes severe mental and physical delays, and strangely, a persistent and inexplicable happiness.
When they told me it was definitely Angelman syndrome, it was relief. We actually have something.
Dr. Adams suggests that Andrea first showed signs of Angelman syndrome when she started smiling at just 2 weeks old.
We're not sure why individuals with Angelman syndrome have a very happy and excitable personality. It's likely related to the impact of the chromosomal abnormality on the nervous system.
The feeding and vomiting problems Andrea has been experiencing are also indicators of the disease.
The first sign can be low muscle tone. These individuals can also have low muscle tone in their GI tract, which may make eating much more of a challenge and can lead to an inability to gain weight.
Dr. Adams goes on to explain that Andrea's microcephaly is a direct result of her condition.
Individuals with Angelman syndrome tend to have poor brain growth, and hence you will have a small head size.
The neurological effects of Angelman syndrome can take a heavy toll. Sufferers are known to experience jerky hand flapping and uncontrolled twitching and flailing of the limbs, which Andrea is already beginning to display.
The cerebellum seems to be impacted. That is a portion of the brain that is involved in balance and coordination. The hand flapping and jerky leg movements are associated with the impact on the nervous system.
He told me she was going to have a very hard time using her body, sitting up, walking. 10% of individuals don't get the chance to walk. That hit very hard.
The disease is also clearly affecting Andrea's ability to speak.
One of the cardinal features of Angelman syndrome is lack of speech acquisition. Even with intensive speech therapy, they typically only acquire about 6 or so words. So it is a lifelong challenge for them.
They told me she probably will never say anything, but she will be able to communicate in different ways. Sign language, picture boards, and that's all right by me. But it sure would have been nice to hear Mama.
Unfortunately, problems with speech and motor skills are just part of the Angelman equation. The main danger facing patients is potentially life-threatening seizures brought on by their abnormal brain activity.
Seizures are a major component of Angelman syndrome and can present in a variety of ways. So that would be something that we would have to keep a careful eye on with Andrea.
But while Heather does her best to make sense of the sobering news, the one thing she still can't understand is why Andrea's condition wasn't diagnosed sooner. Dr. Adams explains that Angelman is very rare, diagnosed in only 1 out of every 20,000 births.
Angelman syndrome can be challenging to diagnose because the initial symptoms are pretty nonspecific. Typically, Angelman is diagnosed when individuals are a little bit older because you can put more of the pieces together. The most critical thing with Angelman syndrome is to initiate supportive services as early as possible. Speech therapy, physical therapy, occupational therapy. Andrea, not being diagnosed, may not have received supportive services, and that may have had an impact on her overall growth and development.
We set up an appointment for counseling, and tears came to my eyes, and I called up my mom and my sister, and I said, this is it.
When Heather called, I was like, well, at least you know now. You know how she's going to progress, how she's going to grow.
Her life's going to be very simple. It was definitely sad, but it was also refreshing to know that she had no idea. She was just happy.
Today, Andrea is 1.5 years old. She goes to occupational therapy twice a week and has already made remarkable progress in her overall development.
I see so much change in her. She really all of a sudden started to blossom. She is trying to stand up more. She's a lot steadier with her movements. I would love to see her walk. That is my #1 goal.
But regardless of what challenges the future may hold for Andrea, one thing is sure to remain constant: her smile.
She's still happy as ever. She's eating. She's growing. She's doing pretty good.
I just want her to have a happy, healthy life. She's going to have a lot of support. We love that little girl to death. She's my sweetheart.
Andy is such a happy baby. She lights up the room, and you just can't help but feel yourself smile along with her.